Medical treatment termination of pregnancy in case of risk to life of pregnant woman, number 2 bill, second stage. I call on Deputy Clare Daly to move the second reading motion.
Thanks, Ciarán Comhairle. I move on sharing time with Deputies Collins, Higgins, Healy and Flanagan.
Thank you. Could I just ask, do you move that the bill be now read a second time?
That the bill be read a second time?
Come on.
Sure. Ciarán Comhairle, I think it is incredibly, I find it sad and angry to be here again. We said in April when we introduced legislation on this issue that if the government didn't move on it, that we would move on it again. A scenario that we hoped wouldn't happen, but sadly here we are. Now, we had to listen earlier to the fanfare from Minister Riley, more or less along the line, sure, what's the rush? We have the report now, even though the media had it a week ago, and we'll decide what to do about it before Christmas. Not that you're actually going to do anything before Christmas, just you'll decide what to do. Then we can sit around and talk about it for 3 days in the Health Committee, and this is posed as some sort of big concession. We should be clear, this item was on the agenda of the House for discussion this week. It was bumped to next week because of the budget, and now Minister Riley is posing as a concession that it's going to be addressed next year. The Taoiseach talks about more time, needing consensus, needing to move forward carefully. And while the Minister let slip earlier in an interview the words legislation, he then quickly corrected himself. So we know with certainty that there isn't any certainty coming from the government, that the very same arguments we've been hearing over the decades are being repeated. The very same arguments we heard when we moved the bill earlier, give us more time, we're hearing yet again. And we're here to say that that simply isn't good enough, because the person who hasn't got time is Savita Halappanavar. How many other cases are we going to wait for? When we moved this bill, or an amended version of it earlier this year, this woman wasn't even pregnant. Now she's dead. Are we waiting for another such case? Because you see, Minister, it was almost 2 years ago when the Council of Europe found Ireland guilty of violating the human rights of women by failing to provide for our constitutional right to an abortion where our life was in danger, including a danger of suicide, 2 years ago. And the response to that, and the response to the requests of the Council of Europe for interim measures is, well, sure, we're looking at it. I frankly don't think that's good enough. The expert group findings are no surprise. They're exactly as we knew they would be. They're exactly as the other expert groups have been. They're exactly as the Supreme Court has said. In order to secure a woman's right to an abortion in these very limited circumstances, there needs to be legislation. Simple as. It's actually not that complicated. And what our bill here does tonight is to provide the basis for that legislation. We're not saying it's perfect, but it's a start. If you do not take this start, because we all know the passing of legislation is simply in a commencement situation, if we don't make a start tonight, it means the legislative process will not start until at least another 4 or 5 months' time, and that, frankly, isn't good enough. In actual fact, the only negative that the expert group said about legislation was the very fact that it might be, in their opinion, take a considerable period of time. Well, we've saved the House that time by providing the basis upon which to start. That's all we're saying, and have no doubt about it. Against the backdrop of increased austerity, the option of the boat or the plane isn't going to be an option for sick women in this country in the intervening 4 or 5 months' time. If we don't begin this process tomorrow, we are condemning women and their doctors to the same legal grey area that has been the subject of an outpouring of emotion from women and the medical profession on the airwaves over the course of the past month. And how could anybody say that this is rushed? I have to say that for me, the saddest part of moving this bill is that it doesn't even begin to deal with the majority reasons why thousands of Irish women have to choose abortions every year. That it doesn't deal with the circumstances of pregnancies arising out of rape or incest, the decisions that people have to make because they're too young, too old, or many diverse circumstances. The women who have contacted all of us because their fetus had a fatal abnormality, and this state condemned them to carry that to full term or to be exported in secret with stigma and shame. I think it's an absolute scandal that this House cannot move legislation to deal with this, to deal with simple medical procedures which are in reality a private and personal matter between women and their doctors. And the reason for that is this 8th Amendment in our Constitution, and we will be championing the call for the repeal of the 8th Amendment, but sadly that is not the subject of what we're here for today. And the first step, but a vitally important step, is the one of legislating for X. And this isn't simply a reintroduction of the same bill that we tabled earlier in the year. We listened to what the government said at that time, and we made relevant amendments to that, which we think have satisfied the concerns that were aired at that time. What does our legislation do? Well, the first thing it does is remove the Offences Against the Persons Act from being valid in this area of medical treatment of women who need an abortion to save their life. That is absolutely necessary provision. The second thing our bill does is to lay out very clearly a criteria for how doctors can assess the risks of a pregnant woman, that where 2 doctors have an honestly held and reasonable belief that as a matter of probability there is a real and substantial risk to the life of a woman, that they are legally empowered to carry out an abortion in those circumstances. In the case of suicide, it will be the opinion of a consultant psychiatrist or a clinical psychologist, or an arrangement or combination of both of those to make that medical call. I am aware that the expert group has suggested maybe a different combination of medical practitioners, and that's absolutely fine. That can be amended at committee stage to take account the best medical decisions, because we agree with the expert group that these are medical decisions between women and their doctors, and all we can do as legislators is provide the primary basis on which that can be done. Our bill very much allows then after that the option of a further opinion to the woman from either a medical practitioner of her choice or a referral from the other doctor. It also allows for the establishment of an appeals body, the details of which would rest with the Minister for Health to give that validity, and that body should be timely and come to a decision, we say, within 1 day, because we are talking about the circumstances where a woman's life is in danger. So what you can see, even by accounting for those things, is that we've provided the primary legislative basis which can be built upon and added to by regulation as recommended by the expert group. It isn't really that difficult. Every other jurisdiction manages it. Further on, our bill in section 7 allows for a medical practitioner to conscientiously object to participating in this procedure, as long as the woman's life isn't jeopardised by that, as long as they provide information, and as long as they refer that woman on to somebody else who will carry out the necessary medical treatment in that regard. And of course, conscientious objection should not be in existence for a hospital or for somebody not directly involved in the medical procedures.
2 minutes.
And the other 2 pieces that we addressed were the ones which the government highlighted earlier as being in need of change, and they were the areas of consent and the areas of offences. And we're very satisfied with these areas this time round, because in relation to the woman consenting, the normal basis in other laws exists. But we had a problem last time round with young women under 16 whose lives were in danger, but whose parents didn't want the young girl to have an abortion. And thanks to the government moving the children's referendum, there is an emergency provision for the state to opt in and act as guardian to a child who is threatened, and we think that that overcomes that problem in our bill the last time. The last point deals with offences, harassment and so on of people who secured abortions or facilitated somebody else in securing one, and that's very much rooted in the Non-Fatal Offences Against the Persons Act. So we're very clear that this is quite straightforward. It's not complicated. It is a simple piece of legislation, of primary legislation, which can be built upon and added to by regulation. And we are really appealing to the government not to oppose it. And I make that with no cheap political point scoring. This bill has my name on it. In reality, it was the joint effort of myself, Deputies Wallace, Collins, and has the full support of the United Left Alliance, and a number of our staff were involved in drafting it. But this can be a bill belong to this House. We can all take ownership of it and send a signal to our colleagues in Europe, to whom you have to report to next week, to say, what has this country done to protect the lives of women in our state? We can say, by moving this on to committee stage, that to the women of Ireland, to the doctors of Ireland, that actually we do take their concerns seriously, that the continuation of grey areas shouldn't last for another 4 or 5 months, that we have actually heeded their call. We've taken note of what happened in that tragic situation in Galway, and we have expedited and moved on a situation which for 20, 30 years we have religiously and studiously ignored. That's your choice, Minister. It's the government's choice. We can do something to salvage the reputation of this country and vindicate the rights of women, and it's really in your course from now.